Good afternoon, everyone. I'm pleased I was able to contribute to this session, albeit virtually. I'd like to acknowledge Maysan Kabalan, a doctoral student in epidemiology at the American University of Beirut, who worked with me on this presentation. I have nothing to disclose. So my talk is about the burden of dementia in the MENA region. The Middle East and North Africa includes 21 countries, according to the World Bank. They share common challenges and cultural links different from neighboring countries. Arabic is the principal language. However, the presence of minority groups in most of these countries contribute to their diversity. The region has vast oil, petroleum, gas reserve, but also afflicted by persistent conflict and severe economic deterioration. And therefore, 16 out of the 21 are classified as low and middle income countries. The MENA region is experiencing major demographic transition. So the proportion 65 and above varied from 2010 from 0.4% in UAE to 7% in Lebanon. And in 2030, it's projected that the range would be 3.2% in Yemen, which with low life expectancy, to 12% in Lebanon and Tunisia. So the MENA is experiencing rapid aging. So the projection made by the UN Department of Social and Economic Affairs are worrisome. So the percent increase in population 65 and above between 2030 and 2050 is almost 400% in Qatar, 129% in Jordan, 75% in Lebanon, while the world population is percent increase in proportion 65 and above is 34%. So this is the Alzheimer's Disease International and its 2015 report estimated number of people living in dementia in the MENA to be 2 million people, with expected increase to 10 million in 2050, an increase of 329%, the second fastest in the world. And Europe actually has a caseload estimated at 74, the increase in case of 74%. So although those estimates are based on a handful of studies, but they are source of concern, especially that they are compounded by the lack of awareness at the community and government level. So dementia is not a health priority, and therefore it cannot compete for resources. In some countries, we still have high burden of communicable diseases. There's no public awareness on the topic. So one study investigated knowledge attitude towards dementia in primary care attenders revealed minimal knowledge, negative perception, and poor attitude towards the disease. Dementia is associated with high stigma, and this in turn is a barrier to seeking care and treatment. In general, we have shortage of services for older adults in general, and we have more shortage for people living with dementia or need care for dementia. Last but not least, we have also a lack of data on number living with dementia that's mainly hindered by the lack of validated and uniform screening and diagnostic tools. So in 2015, there was only 2 studies that ATI used to estimate prevalence. We did a search on Scopus. June 2023, we use several terms, key terms, dementia, Alzheimer, all the keywords linked to the MENA region, focusing on Arab countries, and we got article 1200 article. But when we linked to prevalence of epidemiology, we got 250 document that talks about prevalence of diseases. So with this graph present the distribution of those articles, the 250 article by year of publication. You notice that there were very few before 2011, and it's only in the last decades that we see that there is a marked increase in the number of publications. So this is promising, but still means that we need more research to know about the status of dementia in the MENA region. When we examine the affiliation of authors in terms of institution and countries, so and we did some like bibliometric analysis. So we see that most dementia studies are mostly from, their collaborators are from the US, some of them from, so the US mostly, and of course we have other local researchers. And then focusing specifically, since we want, the interest is burden, as the title of my talk indicates. So we want, because burden is the key to allocate resources for dementia care, diagnosis, prevention, and treatment. So we read the 215 articles and were able to identify only 17 articles whose focus is prevalence. So a very limited number of primary study conducted in the Arab country. And when we look at the funders for those 17 prevalence studies, they were only 4, at least 4 that we were able to locate. No other funding sources was identified from the publication. To note that we have one of them is the National Institute of Aging under the umbrella of the National Institute of Health. And now focusing more on those 17 publications on prevalence of dementia, these comes from 7 or 8 countries. So the target population are different. They're community-based, elderly in nursing home, inpatient. The tool used to diagnose and identify dementia are non-comparable. Even in one country, the method differed widely, no harmonization of measures. So those percentages are a mixture of mostly crude prevalence rate, and they are not standardized. So the only standardized was in Lebanon, where the crude was 7.4, and the standardized based on the European population was 9. So in terms of estimate of dementia, we couldn't find any, we could find only one. That's one of the studies that I have conducted with a cohort of like 324 community-based older adult. Of course, this is a small study that yielded a crude incidence rate of 16 per 1,000 person year in 2018, and the standardized rate of 20.5 per 1,000. And if you see the graph, it's really one of the highest. And actually, this study looks like that we are very close to the European and North American country estimate. We use standardized measures and validated tools, which increase actually the internal and external validity of the result and allowed for the comparison. Yes, we are criticized for the small sample size. We had only 19 incident cases. Nevertheless, we feel that at least it is based on solid method. So what are the existing, what are challenges first to research and on dementia? Lower national funding compared to other NCDs. We lack, as I said before, standardized neuropsychometric batteries specifically for the region. We don't have any registry for the disease, similar to European country. Many countries, they lack good research infrastructure and public support for the disease. And some research projects have in many instances been delayed or canceled due to many regulatory and bureaucratic hurdles in most Arab countries because of also their institutional review board or not being able to have the proper procedures to conduct the study. But there are opportunities in order to improve and produce more evidence and good evidence about the status of dementia and the burden of dementia. And those opportunities, one of them are the national programs for dementia. So we know that there is a global action plan that was set up by the WHO, which is in response to dementia 2017-2025. But we know as well that only 1/4 of the country in the world region have adopted a national policy or put in place a strategy or a plan, and half of those are in Europe. In the MENA region, it's only Qatar who actually is working now on a dementia plan for its local population. And this is part of an integrated plan, which is healthy aging, which is part of the Qatar National Health Strategy 2018-2022. Another opportunity to improve dementia care and again produce more evidence, good evidence, and collect better data and improve the whole situation of the dementia is the presence of major stakeholders in the MENA countries, such as the Alzheimer's Disease Association. But to know that only 4 countries have Alzheimer's Association: Saudi, Lebanon, Oman, and UAE, and these can help raise awareness. They can play a role in creating dementia-friendly community, but they can as well support a researcher in their research by maybe community engagement and encouraging patients to participate in the research study. So what else? So I think a very important opportunity are local national study that are ongoing now. And we have two major ones, Al-Sahha, Lebanon Study on Aging and Health, and Al-Sahha. Both of them, they mean health in Arabic, the health of older adults. So the Al-Sahha is a national longitudinal research study on dementia and related health and social challenges in Lebanon. This is the title. This is a project that will establish a cohort of 3,000 older adults in two major areas in Lebanon. We consider that Al-Sahha is part of the worldwide network of the harmonized study. And it is modeled after the health and retirement study. We're trying as much as possible to harmonize our tools with theirs. It is funded by National Institute of Aging under National Institute of Health with the R01 grant. We have country researchers for the American University of Beirut and the Faculty of Health Sciences and the Faculty of Medicine. And our collaborator and the main PI is from Georgetown University, and collaborators are from the University of Michigan. And this is the website for people who would like to learn more about it. But there's also Al-Sahha, which is our friend. And our very close friend from Egypt. It's a prospective cohort study on aging in Egypt with the internet. They have also their own international collaborator with the Munich Center of Economics and Aging. And they are part of SHARE, which is the Survey of Health, Aging, Retirement in Europe. Their sponsor is the German Academic Exchange Services, and I believe that now they are submitting an R01 to the National Institute of Health, and they have local collaborators from Egypt. I think with acknowledging all the challenges, but also looking for those opportunities, I think they can address all those research priorities, many research priorities in the MENA region, starting from